Hello, today me and my group is going to talk about the Yellow September. My group is Rafael, Yasmin, Sara and Leandro. The topics that we're going to talk about are things that cause people to commit suicide, a history where talking was important, and talking is important. Things that causes people to commit suicide. Depression is the biggest risk factor for suicide. It is necessary to combat the factors that trigger depression with the help of health professionals, in addition to spirituality, which helps in the treatment. Today, the main causes of suicide are linked to mood disorder, which is depression, schizophrenia, and bipolar disorder, also the rampant use of drugs. These have the power to affect people's mood and personality, leading them to depression and remorse. Today, it is perfectly known that there is a suicide gene. During the Latin American Congress in Chile, this gene was discovered, and it is said that there is a genetic factor involved in it. A history worth talking were important. Tainan, 26, is a nurse and reports that she saw her life being filled with deep feeling of sadness 5 years ago. She suffered from moderate depression. When she took a high dose of tranquilizers, she passed out and was admitted to a hospital. The young woman said that after talking to people, she no longer wanted to kill herself. She just wanted to relieve the pain she was feeling. Tainan had professional help, which represented the rescue of his life. When diagnosed with depression, she underwent psychiatric follow-up and started taking antidepressant medications for 3 months. She also decided to return to the Spiritist Center in search of a behavioral and spiritual psychologist. After being depressed, she saw the meaning of life again. Tainan says she had the support of friends and family, in addition to her love for dogs, which helped her to overcome her depressive states. Talking is important. So a very good way to treat this depression and help against the suicide is by talking to a person, giving it time to speak and understanding this person, making a kind of bond or by just letting them talk.
Hello everyone, today we're going to be talking about Yellow September and I'm going to be presenting a slide for you all. So now I'm going to present you the topics that are: what is Yellow September, what is depression, how is depression related to Yellow September, and how to get treatment from depression. First topic that we're going to be talking about is what is Yellow September. Yellow September is a campaign that promotes life awareness and appreciation, an open space to discuss the causes of suicide and preventive interventions. That is the best way to describe the event titled Yellow September Appreciation of Life, held by FGV Teaching Support Center NAP. To be talking about what is depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, they are also treatable. Depression causes feelings of sadness and a loss of interest in activities you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Now we're going to be talking about how is Yellow September related to depression. September 10th is the World Suicide Prevention Day, and it's throughout the month that people talk about the subject. However, sometimes we put aside the impact of the work environment on life of the people who are going through emotional problems. So now we're going to be talking about how to get treatment. The first step into getting treatment for depression is making an appointment with your general practitioner. They can recommend doctors in your area, and if you're religious, ask your religious leader if they have counselors to recommend. Some people prefer faith-based counseling, which incorporates their religion into a treatment plan. You can also check healthcare databases for therapists, psychiatrists, and counselors. They These databases can provide you with information such as certifications, accepted insurance, and reviewed by other people.